How's it going, guys? We have a pass level question for GI Step 1, Pediatrics, IM for 2CK. 12-year-old girl brought to the physician for a follow-up appointment. We have this very buzzy biopsy shown, which I'll talk about as we move through the question. Which of the following most likely seen in this patient? Let's just hop through. Choice A, antimicrosomal antibodies. Wrong fucking answer. First, a primary biliary cirrhosis. It's going to be a woman, 20s to 50s, who has generalized pruritus, high cholesterol, high ALP, high direct bilirubin, and they will always mention an autoimmune disease either in her or in a family member. They might say the brother has rheumatoid arthritis, the sister has IBD, she has vitiligo. They love that. Wrong fucking answer. Choice B, decreased stool pH. Wrong fucking answer. So this refers to lactose intolerance, lactase deficiency, where you can do a decreased stool pH test or a hydrogen breath test to diagnose. Now, some students might say, well, in this condition, this question, which I'll talk about in a moment, couldn't you also theoretically see a decreased stool pH? Even if that is the case, it's fucking wrong, okay? They want you to know that decreased stool pH is specifically lactose intolerance on USMLE, and you're going to see normal intestinal villi on biopsy in lactose intolerance, okay? So you have deficient disaccharidase lactase at the brush border, so you can get osmotic diarrhea because you have high solute concentration within the small bowel lumen. Wrong fucking answer. Choice C, microcytic anemia. Correct answer. Diagnosis, celiac disease, extremely buzzy biopsy showing us flattening of the intestinal villi. They want you to know that you can get iron deficiency anemia. Okay, it's exceedingly high yield. Now, especially on 2CK, where the questions can be longer and more difficult, you get a big fucking paragraph, have no idea what's going on. You're like, I don't know whether it's lactose intolerance, whether it's celiac, but somewhere in the stem where they might give you lab values, you're going to see that there's a microcytic anemia, and you say, boom, celiac disease, okay? Iron's absorbed in the duodenum, and the flattening in the intestinal villi is going to prevent the absorption of iron, okay? It's an exceedingly high yield detail for celiac disease, and it's often overlooked by students. So there's other findings you can get celiac disease, such as T-cell lymphoma. It's exceedingly rare, but you could be aware of that on the back burner. Let's just hop to the other answers here. Normal D-xylose test, wrong fucking answer. So this is also important to know. So D-xylose is a monosaccharide that does not require any enzymes for absorption. In order to absorb it, you need to have normal architecture of the intestinal lining. So in celiac disease, because we have flattening of the villi, we're not going to be able to absorb D-xylose as well as we're supposed to. So you'd have an abnormal D-xylose test. This can also be the case for Crohn's disease, where you can have impaired absorption. In contrast, lactose intolerance will have a normal D-xylose test. It will be picked up in the blood/urine because the intestinal lining is intact, as we talked about. So lactose intolerance is a normal D-xylose test. Pancreatic insufficiency, normal D-xylose test, okay? And it can be any number of causes. It can be pancreatectomy, it can be chronic pancreatitis, let's say in an alcoholic who has steatorrhea, and you're trying to determine the etiology of the steatorrhea. Also, CF, okay, cystic fibrosis, we have exocrine pancreas insufficiency in a kid, all right? So you're gonna have normal D-xylose tests for those conditions. Wrong fucking answer. Choice Z, PAS positive macrophage lamina propria. Wrong fucking answer. First, Whipple disease, okay? So 100% of questions, they're gonna mention this for Whipple disease. Garbage diagnosis for USMLE, exceedingly low yield. It's just a bacterium, Tropharima Whipple or Whippeli, however the fuck you pronounce it. And it can cause a multi-organ system pathology, arthritis, sometimes cardiac, renal dysfunction. But it's a malabsorptive condition as well, where they get that PAS positive macrophages, lamina propria on biopsy. They always give you that detail. And there's a question on 2CK where they actually want you to know that you can treat this, okay, with beta-lactams, tetracycline. Wrong fucking answer. You know the deal. I'm going to make more content if you like my subscribe my channel. I appreciate your time. That's it.